Good morning, everyone, or good afternoon, or good evening, depending on where you are in the world today. Welcome to this webinar that is co-hosted today by the Break Exchange and the Arch National Respite Network and Resource Center. My name is Kim Whitmore, and I have the pleasure of serving as the director of the Break Exchange. I want to pass it off to Jill Kagan, who's going to say a quick welcome from Arch.
Yes, good morning, good afternoon, and good evening to everyone who's on the call today. I'm Jill Kagan, Director of the Arch National Respite Network and Resource Center. And as always, we are very excited to be able to co-host these Break Exchange webinars to hear from our international colleagues. For those of you who aren't familiar with Arch, we provide a variety of training and technical assistance services to respite providers and family caregivers across the United States. And I'm especially pleased today, Kim, you can go to the next slide, to let you know about our upcoming National Lifespan Respite Conference. If you're not aware that it's happening this May in Albany, New York. We have just extended the deadline for early registration. It says April 15th, but we just yesterday extended to April 22nd. So you'll have an extra week to benefit from those early registration rates. And at the conference website, you can find the full program. And all of you are more than welcome to join us. We'd love to have you there and see you there in Albany. So thank you again, Kim, for the opportunity to co-host with the Break Exchange.
Great, thank you so much, Jill. So just want to share a little bit about the Break Exchange for those of you who may be new and coming to this webinar without background knowledge of the Break Exchange. So BREAK stands for Building Respite Evidence and Knowledge, and we are an international group of researchers, respite providers, agencies, and really anyone that is committed to building a culture of evidence-based respite care. We have several amazing partners that help to form the Break Exchange, including Arch, the International Short Break Association, Marquette University, where I work as an assistant professor in the College of Nursing, and our friends at Shared Care Scotland. There's lots of great benefits to joining the Break Exchange, which is free. You can connect with this great global network of researchers and providers, agencies, and individuals. To help with that, we host a monthly networking hour. We also are very happy that we have over 200 members from 18 countries and growing. So want to welcome you to that group. We help to promote evidence-based respite care practices and happenings around the world. So it's a great place to learn about what's happening in the respite community. It's a place where you can also share what you're working on. So we can help feature things in our e-newsletter that goes out monthly. We can put things on our website, on our social media platforms, or you can come and present a webinar just like this that's happening today. And then we really are hoping that this network continues to allow people to connect and collaborate together. So if you are a respite program interested in doing an evaluation or research project, you can use this network to identify potential partners for a project and vice versa. If you're a researcher looking to conduct a study in a certain population, we do have on our website a member database, and encourage every member to create a member profile that shares a little bit about their interests and where they are. That will help kind of allow you to search and find people that might be good collaborators for you for your next project. So we invite you to stay connected to the Break Exchange. We have our socials up there. We have an email list that you can sign up to on our website, and we'll pop that in the chat in just a minute. And if you have any questions or would like to engage in any of the webinars or anything else and share what you're doing, feel free to email us at any time. And I'd like to end with a little reminder to all of us who do this work to help support caregivers that we also need to practice our own self-care. And I like this quote that says, self-care is giving the world the best of you instead of what's left of you. So our wish is always that we are practicing what we preach and ensuring that we are taking the breaks that we need in order to be our best at the work that we do in supporting caregivers. So with that, I am going to briefly introduce our speaker for today and hand it over to him. So we're delighted to have Richard Mead here from Care Scotland, and he is going to be presenting on a qualitative study of adult carers taking a break called It's Like a Weight Lifted Off Your Shoulder. So I'll pass it off to you, Richard, and looking forward to your presentation. While he's getting his screen share up, I just want to remind people to please keep themselves on mute. And if you do have questions, pop them in the chat. We're going to take questions at the end, but feel free to post them in the chat as you think of them so you don't forget them. And then I will help to facilitate the Q&A at the end of the conversation. So without further ado, the floor is yours, Richard.
Thank you, Kim, and good morning, good afternoon, and good evening to everybody. I'm really pleased to be here to talk to you about this piece of research, and delighted to be part of your seminar today. Very briefly, as introduced, my name is Richard Mead. I'm the director of Carers Scotland. Carers Scotland is part of a UK-wide charity called Carers UK, and Carers UK, we are a charity that is all about supporting. We generally use the expression unpaid carer, but obviously I think there's family caregiver, informal carer, lots of different terms to describe what we mean when we talk about carers. And our work includes primarily lots of campaigning and lobbying work. We really work with the various governments across the UK to try and influence them to make changes to better support unpaid carers, whether that's about having a right to a break, which is certainly a topic of discussion in Scotland right now, through to social security support and the level of financial support that carers receive. And as an organisation, we also provide support to carers directly through for helpline information support, as well as we provide peer support and networks for carers and opportunities for carers to come together to talk about their caring role and get information, advice and support. So we're quite a small charity, but we do an awful lot of work in those spaces. And I, as part of my role, or one of them, I undertook a part-time master's in public health while I have been at the charity, and I've just realised I'm at the very, there we are, start again, excuse me. And I did a part-time master's of public health at the University of Edinburgh, and in my third year I was required to do a piece of research. So obviously it made absolute sense to me to look at something around what unpaid carers are experiencing. And the one thing we know, probably globally, if certainly at least we know in Scotland and across the UK, is that many carers do not get a break from their caring role. And those that do get a break from their caring role often report that it's very positive and makes a big difference. And so as organisations, we're constantly calling for greater access to respite. So I thought I would use my research opportunity to really explore this issue of getting a break and what it means for carers. So this is a qualitative piece of research that I did for my master's in public health. It is currently, I have submitted it for publication and with a journal, and it's out for peer review. So I'm hoping that it will at some point in the future be published as well. But I'm obviously very happy here to share with you the results of the study. So the background, this is very much a UK context, and the study took place in Scotland. But in the UK, there are close to sort of 6 million people providing unpaid caring roles. And as is the case in probably many parts of the world, those carers can be partners, spouses, siblings, parents, children, friends, or neighbours. And they provide a range of support for people, including personal and domestic care, as well as healthcare support. And they are very different, as we would always say, to professional paid carers who might come in and provide that service on a paid basis. And I think what's really interesting is we've done work in the UK to sort of work out just how much carers contribute in terms of health and social care. And in the UK, we estimate that £162 billion every year in health and social care costs are provided by unpaid carers. To put that in US dollars, I think that makes it about $203 billion in the US terms every year unpaid carers contribute. So it's a huge contribution they make that really underpins and supports the health and social care system in the UK. In fact, I think if unpaid carers gave up their caring roles, then the health and social care system in the UK would simply collapse within a matter of minutes of them doing that. So they're such a significant part. But what they do not get is the support they need to do that caring role. And again, research has shown that nearly half of unpaid carers in the UK have been able to take a break in the last 5 years. And that is huge. That is a massive number of people that are just not getting a break from care. And again, we know the research shows quite clearly that caring has a huge impact on the health and well-being of carers, particularly if they don't get that support that they need. And respite breaks and respite support really does help carers, or it's considered to be essential for carers to help them to continue to care. And in the UK, generally what we talk about, and again, it's probably similar globally, different forms of respite can be appearing. So you can have the respite care service can include 1 day daycare services. It can include temporary residential care. And by that, I mean somebody goes to stay at a institution, and that can be a care home or nursing home or another specialist institution. And that allows the carer to get a break from the caring role. They can get in-home respite, so that's when somebody potentially comes in to provide support for the cared for person, which allows the carer to get a break. And a break can last for just a few hours to several days and more rest, and it really does sort of give those carers an opportunity to get a break. So the aim of this study is really was to explore carers' experience of breaks that are enabled by people using temporary institutional respite. And the reason I chose this area, there's a number of reasons, but there's a lot of literature that's currently out there that shows conflicting findings regarding benefits regarding people using temporary institutional respite care. There is the benefits that show that carers experience reduced levels of stress, improved quality of care, feeling more positive about their caring role. Although there is a counter that sometimes those benefits don't last that long. However, there is also some evidence to show that temporary institutional care sometimes has mixed and unexpected adverse effects on carers, leading to sort of increased levels of stress, particularly following a break. And I think the one thing that is certain that there is really not a massive amount of research looking at temporary institutional respite and what that means for unpaid carers. So that's sort of what drove my study, is to try and explore that area a bit more, to see where the balance might lie in terms of people's experiences of that and what it means to them. So this study sought to explore the experience of carers, of adults in a home setting who'd had a recent break of anywhere between 4 and 14 days from caring using a temporary institutional respite facility, and the impact that had on their caring role. So there's my research question that I so I'm just going to reduce this so I can see it clearly. So you can see my research question there, and I did 10. I interviewed 10 carers, semi-structured interviews, and carers were asked about their caring circumstances, their recent experience of a break, what they did with their time, how it made them feel, and the impact it has on their well-being. And they were also asked about what led them to take a break and if they would continue to take them in this way. I did 9 of these interviews virtually using Microsoft Teams, and I did one by telephone because the participant didn't have access to computer software to allow for Teams and Zoom. I used an institutional respite service in Scotland, near North Berwick, if anybody knows this part of the world, which is not too far from Edinburgh. It's Lukey House, and they provide expert respite care for people particularly with neurological conditions, multiple sclerosis, Parkinson's, people recovering from or living with the consequences of stroke. So that's who I spoke to, and I'll come on a bit more about the specifics of those people in a minute. And then the analysis I chose to do was reflective thematic analysis, which is the approach developed by Brown and Clark, and there's sort of 6 steps of that process, and that analysis leading to sort of key themes, which I'll come on to. Oh, my screen seems to have. There we are. So, as I said, I had 10 participants in this research. 6 were male, 4 were female, and that in itself was quite interesting because we know that certainly in the UK that predominantly most carers are female, and that often is in a lot of the research. Actually, you would find the balance is usually predominantly female to male. So it was interesting that I got 6 males and 4 females. 9 of them cared for a partner or spouse, and one person cared for their father. There was a sort of a range of ages of the people that they were caring for, and the range of ages for the people that provided the caring role. And 8 of the people that were being cared for had a primary diagnosis of multiple sclerosis, and 2 people were caring for people with disabilities that were resulting from a stroke. The reflective thematic analysis uncovered 6 key themes, which are listed there. Caring is all-consuming. Caring changes a sense of self. Relief, recovery, repair. Breaks give carers their lives back, albeit briefly. A break doesn't solve everything, and the respite center is crucial. So I'm going to take you through each of these themes and talk a little bit about what the research found, and share with you a few of the quotes and commentary that came from the participants. And then I'll talk a little bit about some of the sort of conclusions and that came up with. So caring is all-consuming, and I think this came across abundantly from all the carers, is that this that they had such little time for anything but caring, and it actually just resulted in a huge impact on their mental and physical health. But what was really interesting that came out was just how much they talked about it was the mental health that was often stated as the greatest consequence of caring role. Yes, the physical health was often significantly impacted, but that mental health impact was huge, and exhaustion came across so strongly, and people were just literally pushed to the point where they couldn't cope. Many talked about never switching off from their caring role, even when they actually weren't carrying out that physical demands of caring. It totally dominated their thoughts. And actually, many of them talked about this being time limited, that they actually knew that they would reach a point where they could no longer carry on doing the caring role, and that they might actually have to stop, and what comes with that. And again, they talked about, as part of that, is this way that as carers, they were always putting the needs of their cared for person first. And sometimes this, the carers talked about, actually their cared for person expected them to put their needs ahead of those of the person, of their own needs as carers. And actually, many of the carers I spoke to talked about their feeling their own needs weren't recognized, they weren't valued as carers, and that there was this expectation on them that they would carry on regardless of what they were feeling, the level of their health, and whatever their needs were. And that just, for them, meant it was just all-consuming. And again, it was this idea that they just could not switch off from that caring role, and the huge responsibility that came with it. And they felt that, like, this was a duty to care, whether that was because of the nature of their relationship, whether they're a partner, spouse, or that they're just dependent on them because of the lack of services or support, or just the fact that they felt that they had this responsibility. And they often felt it was borne purely by them as that carer and that cared for person. And here are just some of the couple of quotes that really sort of highlight that. And I think, came across really strongly about how carers felt that they didn't know how much longer they could do this caring role. And again, somebody there describing just how hard caring is in terms of a work. And again, really emphasizing that the mental side of it, the mental aspect of caring, is what is that biggest consequence, even though it is physically demanding as well. The second theme talks about, really came across strong, was that carers felt like they had some really big psychosocial consequences of caring that actually had a big impact on their mental health. But their sense of identity, their sense of self, it really was this sort of feelings of losing themselves in their caring role, and the erosion of independence that they have, and the restrictions on their lives because of caring, and the impact that has. One carer described it as saying, when he talked about his loss of independence, he said, that's where you start to feel trapped. And it was really came across strong, that sort of emotive language. And they often talked about their sort of parts of themselves disappearing into their caring role, and the life that they have, and they actually sort of mourn for it. One carer described to me, she said, it's sad to see the life you had, and actually the chance to address some of these issues just gets lost in that caring role. They just don't have the time, the consequences for it. lots of carers talked about not having time to themselves and really struggling to sort of make space for that. And again, and that can have huge impact on who they are as a person and actually start to directly impact on their behavior. Carers talked about how that caring affects their personality. And actually many suggested that the changes in the way they behave were driven by their caring role, and they often referred to negative behaviors, talking about becoming argumentative and withdrawing socially from social circles where they have them, all because of their sort of caring role. And again, I think sometimes they felt that they had lost value in themselves because their identity had changed into being a carer. And one certainly talked about how he felt that when he was in social circles, he had nothing to offer because he couldn't talk about anything other than his caring role, and he had a perception that those that he was with didn't value that or wouldn't value that, so it left him to sort of feel diminished and withdraw socially. And actually this identity and this sense of self and the aspects of their life, they felt like that was completely lost sometimes, and they lose the loss of their personal space at home due to the constant need for professional caring services and medical equipment, and that has a huge knock-on effect. One carer described it to me as like your house is no longer your own, and then another said you lose control when you've got the professionals coming in, and another saying our lives were simply taken away by all of that. And so it really this impact on self and identity and the psychosocial consequences of caring was really apparent amongst all the carers I spoke to. And again, actually this quote from Brian, and these are all pseudonyms, they're not the real names of the people, obviously. He described it like being in the trenches. There's no space for paying attention to things like mood, which is really gives you an insight as to how he sees his caring role as this almost like for him a battle, and there's just no time or space for anything else. He just needs to get through his caring role, which is really quite devastating when you hear someone describe it like that and what it means to them. But the good thing is that these people obviously had all experienced a break, and what was really a clear pattern in the data which showed was just actually what positive impact breaks allowed, and particularly there was a substantial change in mood, a sense of relief for carers when they were getting that break. It allowed many of them to switch off for at least the period of the break from their caring role. I think one carer described it to me as, I don't have to think about it, and that was really telling, and it helps them release that pressure that they build up from all-consuming caring role. And that breaks were beneficial. And actually, when I was doing the interviews, one of the things that struck me, even with doing it virtually, and where you're a little bit more restricted, but you could still see the tone and the body language displayed by many of these carers during the interviews when they were asked about the meaning of a break. You could see palpable sense of relief. They smiled. They actually demonstrated with their hands. It was really telling just how important these breaks were from those sort of physical acts and talking about them to me. And particularly they mentioned their mental health, which isn't surprising considering they sort of portrayed to me just how much of an impact caring has on their mental health in a negative way. So breaks benefited that mental health. And I think for them, what they described to me was that a break didn't have to take on any certain kind of format. It didn't have to be a trip away. It didn't have to be time with friends. It didn't have to be doing hobbies. It just had to be whatever it needed to be to give them a chance to have some time to themselves and to recover a little bit from their caring role. And that was really interesting as well. There was no set format as to what was a good break. And actually many carers described that huge responsibility and sense of burden that they constantly experience as being released, and that's something that they get peace of mind from when they get a break. And actually a break really was for a lot of them about recovery, and actually it helps them to continue to care. So they were reaching these points of exhaustion and points of not being able to continue, and then the break would come, and actually that would help them to continue to care. And sometimes it was really practical stuff. Many carers described not being able to sleep properly because they were up in the night, constantly having to help support the person they were caring for. They didn't sleep well, but a break just gave them that opportunity to get a good night's sleep and help their bodies to recover. And actually many said that without this ability to get breaks, they really did worry about their ability to continue to care and the prospect of that breakdown in care and what that might mean, whether it's somebody that their cared for person having to go into a care home or other institution. So that was really telling. And kind of there's a couple of, again, some more good quotes in terms of how it describes. And actually the title of the research comes from one of these quotes about that weight lifting off your shoulder and you can relax. And again, Brian's quote there, which sort of highlights how close he was to the edge, but actually the break just gives him that time. And again, which kind of reflects this loss of sense of self. A break does help carers to regain some of that, even just temporarily, allows them to reconnect with who they are and to sort of feel like a bit more of their old self. And carers told me a bit about, actually it's to get that break. Truly, they wanted a complete break from their caring lives, and this was really interesting. So they didn't just want a relief of the physical and mental demands of caring, they wanted everything gone. So one carer told me that actually what she did, as soon as her partner had gone into the Respite Institute, she would go home and tidy away all of the signs of caring. So the hoist, medical equipment, all of those things went into another room and the door was shut for the period. And that allowed her to have a true break, which is really interesting. And again, a lot of them talked about this was the one time a break gave them the one time that they could really focus on themselves first, which they found has been so important for their mental health. One describing to me just having time on my own to think, or another saying to get together and just do something for yourself. It was really important, and actually it really helped carers regain important aspects of themselves and their identity that they lose. In fact, one did say, reminds me of who I am. A break reminds me of who I am. And carers do use breaks to reconnect with social aspects of their lives, and many of them find these really valuable and important to do, and they make extra effort on their breaks to make sure they reconnect with family and friends, and they have those social circles, which in a sense reminds them of who they were before their caring role. And again, you can see some of the great quotes that we've got there about having reminding them of who they are and the freedom to do something for themselves. But one thing that came across again is that the breaks don't solve everything. And actually, there was, at least in one instance, a break did not benefit every carer, and it doesn't resolve all their concerns. I think actually what was really telling was that the break was great for the moment and actually for maybe a short time afterwards, but very quickly after the break, there would be a return to some of those mental and physical health challenges that it faced before it. I think those, again, were quite telling. One participant actually described not really feeling any benefit during a break, and he described his experience as quite lonely and feeling quite isolated because he'd been separated from the person, in this instance his wife, that he was caring for, and as a result it didn't feel like he got that benefit, which is important, because I think what it shows is that actually that carers have lots of different needs, and actually how you support those needs can be quite different as well, and that different supports are absolutely needed. Not a one-size-fits-all approach is needed, and particularly around respite and breaks. And actually others talked about difficulty adjusting, being separated from the cared for person, because their caring role is so consuming that as soon as that person is gone, they're actually not quite sure what to do with themselves and how to fill their time, and sometimes they feel like that is maybe a missed opportunity of time not well spent. So that came across quite a lot among some of the carers. And even some described, when they have breaks, experiencing guilt from leaving their cared for person in a respite facility, and that impacted on their benefit from a break, particularly if the person they were caring for was not fully agreeable to go into that respite facility, or and I think that came across quite a lot. And actually this whole link, there was a clear sort of link between carers describing getting a break and that break being positive, as long as the cared for person was having a good experience in the respite center or place that they were. If they did get a good break, if the cared for person did get a good break, then that empowered the carer to have a good break. So again, really important sort of understanding around the role of the respite center, and I'll come on to that in a moment. And again, it does, I think one thing that came across was that there was for many, they just felt their breaks weren't frequent and long enough. So breaks were great, but they needed more of them and they needed to last longer, which is really interesting when you think about implications for the sort of policy and practice and delivery of services. You might think, oh, great, this person gets a break, but are they getting enough of a break? And again, some great quotes there about how the people experienced guilt potentially, and yes, needing longer and more frequent breaks. And one thing that came across really strongly amongst the participants was this idea that the respite centre is crucial. Carers were really unwilling or reluctant to take their cared for patient to just any respite facility, and they emphasised that the right facility is crucial for lots of reasons. Trust and confidence were paramount to participants, as it really allowed them to truly relax and experience the benefits of a break. I mean, many of them commented on their ability to fully relax when they totally trusted the respite centre. And actually, when they described putting them in a respite centre that they didn't have confidence in, then that really impacted on their ability to relax and have a break. So the role of the respite centre is fundamental. And there was a sort of again, that clear link between the happiness of the cared for person and the carer during a break experience, and the role of the respite centre in ensuring that. If they were in a great respite centre with a really good support and that cared for person was having a good time, then the carer just felt empowered to have a good break as well. So such an important role. And actually, what was one of the things that was really interesting that came out in this study was that it became really apparent to me when speaking to a number of these carers that the relationship with the cared for person was hugely significant. And actually, because many of these people that I was talking to were partners or spouses, and their idea of a break wasn't so much about they wanted a break from the person that they were caring for. They wanted a break from the caring role. And actually, the person that they're caring for is someone that they, in these situations, they loved and cared for and wanted to be with. So it's not that they wanted a break from each other. They wanted a break from the caring role. And in this, where the carers I spoke to were using this Lukey House, a respite centre, that actually allowed for carers to also stay with their cared for person at the facility. And this was a huge benefit for those carers, actually, that could do that, because it meant that they could spend time with their cared for person, their partner, their spouse in this case, and actually not do the caring role, but have in effect what felt like a holiday. And actually, for those carers where they were there, they felt like a little bit like they were being cared for too. And actually, one of them said to me, "It was great. It's a good break. It's like a break for me. I feel like I get the attention that I don't get." And another said, "It's like it's good. There's care there for both of us." So that was really interesting, and it shows actually that really important message that when people say they want breaks from caring, it doesn't mean they want breaks from the person they're caring for. It's they want breaks from the caring role, which is the demanding bit. And again, you can see some good quotes about the importance of the respite centre there and the role it plays. It's there, yeah, that huge support that they get and the difference it makes. So I think in terms of it's quite clear that breaks facilitated by temporary institutional care from these carers provide overwhelmingly positive experiences that support the carer's well-being, enabling them to recover sufficiently from that all-consuming nature of caring to be able to continue to provide care after the break. Although, as good as that break is, it doesn't quite solve everything. Sometimes the breaks could not go to plan, or they might have feelings of guilt, or if they're in a facility that they don't particularly trust, then that can have an impact on the effect of that break. And that actually those breaks, the effects of those breaks, when they are positive, can be short-lived, and that carers need longer and more frequent breaks. And the role of the respite centre is absolutely crucial. And I think just in terms of the wider literature, a lot of this research ties with what's said. What's really interesting is that much of the existing literature looks at people that are being cared for that have dementia or daycare. And so we don't often get a picture of other institutional, other respite settings like temporary institutional care or other conditions, like in this case, predominantly MS. But I think what this shows is actually some of the similarities. So it is potential that there are similar experiences, whether it's dementia or MS or other conditions. So that was quite interesting to see that it shared some of the same findings with other research. again, I think what was really good was this sort of added to that evidence base, I think, showing the value of temporary institutional respite. There's lots of evidence, as I say, out there. There's some others that are not quite so clear. But I think, again, when you look at the qualitative studies as well, particularly where you're talking to actual carers, the weight of evidence for temporary institutional respite care really shows that carers value it, which is great. And it's a good example in this. I think, again, this was really interesting because it talked about those aspects of identity and self and the way that people lose that in their caring role, and that I think is a really important finding in this study, and that breaks help them gain some of that back, which is so crucial. And this idea of mental health and how we support mental health, not just the physical aspect of caring, is really, really good to sort of discover. And I think in terms of those sort of longer frequent breaks, that's something that didn't come up too much in the literature review. So this is something that I think has is really important to sort of explore further, because it does have implications for policy and practice. Certainly in the UK, you sort of, if somebody's getting a break, as in the case of many of these carers, as from a government and a policy perspective, many of the policymakers were like, tick, they're getting a break, so that's that looked after. But actually, clearly, even in all of these cases, the vast majority of carers would say that they're getting a break, and that's hugely helpful, but they need more and more frequent breaks. And when you consider that so many people in the UK are not getting a break, to be able to provide them with a break and then actually provide those people with a break more of a break, you start to think from a policy-making perspective, that's quite challenging, because obviously the cost implications, the service implications, capacity, all of those things start to come into question. But I think ultimately, in terms of drawing to a conclusion, I think hopefully this study adds to the fact that in order to support carers effectively, that policymakers should look at ensuring that carers get the breaks that they need, and as often and as frequently as they need them, and that they have access to really good, appropriate facilities, and not just any old facility. It must be the right facility. And so that pretty much comes to the end. And I'm obviously very happy to answer questions. I hope I've stuck to my 30-minute limit. And also, I'm happy to put these in the chat afterwards. Really happy to talk further about this research. I'm on, I'm going to call it Twitter, but I think everyone calls it X these days, or LinkedIn. So I'm very happy to interact further, and of course, have a discussion now and try and answer any questions you might have.
Great. Thank you so much for that great presentation and sharing the results of that study. So great to hear the quotes, and so much that validates things that I think many of us experience and hear in our work, and great to see those themes come up in your study. So I posted in the chat, but I'll say it as well. If people have questions, they can either post them in the chat, or if they want to ask live, they can raise their hand and we'll call on you so you can unmute and ask your question live. So any questions from anyone? People being shy. Okay, while we're waiting for them to think, I'll ask sort of a question, question/comment. So one of the things that you mentioned was this idea of, finding the right respite. And we've written about that in the white paper that we published recently about the value of respite model. And I'm not sure if you've seen that, but I'll definitely share that for folks. That idea that it has to be the right fit. It has to be the right type of respite, the right location, the right providers, the right timing, the right dose, the right frequency. And there's not this like one best model of respite that works for everyone uniformly, because people's needs are unique and we need to ensure that. And so I think the challenge with that is that, like you mentioned, so many people don't get any respite, right? So when we talk about how do we make respite that meets their needs or increase the frequency, like from a policy perspective, that's really challenging. And I think, I'm just wondering if you've thought of how you might take the results of this study, and in addition to publishing it, like what other ways could you use this information, disseminate it in different ways to policymakers, funders, different entities, to help talk about those gaps and how important that is? Because, again, you mentioned that the the benefits are short-lived, right? Like,
Yeah.
yeah, you might get a break and it might feel good for like a week or two, and then you go right back to feeling overwhelmed and stressed, right? So that frequency, that pace or dose of the respite is so important. So just curious if you've had any conversations or
Yeah.
ideas on how you might disseminate this besides just the classic manuscript published in a journal.
Yeah, no, absolutely. And I think it was really striking actually how that came across. And maybe just so like everybody that I interviewed had used the Lukey House service in the previous 12 months. But of course, they'd accessed other breaks as well, not just in that 12 months, but on previous occasions. And they sort of described them. And it was amazing to see the contrast. They'd obviously, I mean, it was a little bit biased in some respect because they all used Lukey House and they continued to use, or they used it Lukey at least once, many times. And they describe that often as the gold standard, which shows when you give a good respite facility, the difference it makes. When they talked about other inappropriate facilities that they would be putting in, so for example, somebody that might be in their 50s and 60s with multiple sclerosis been put in a care home where the only other 3 residents are people in their sort of mid to late 80s with dementia, the inappropriateness of that setting for that person, and also then the experience they have as a result, it's not in, they just and that had a huge impact not just on the cared for person but also on the carer, because they were walking away thinking, where have I left them and are they going to have a good time? And I'm, as a result, they were described feeling guilty and feeling, so all of those things absolutely. But what they also talked about was sometimes those facilities that they had to access like that was because that's all they could get. And that's where it starts to come into your question. In Scotland, which is for those don't, I mean, just a very brief description. The UK obviously is a country, but in the same way, you actually broadly similar in the way that that there are in the US and Canada, you have devolved regions with devolved parliaments and structures that allow decision making. Scotland's the same, and it has responsibility for carers policy as a result. So, and actually, we're currently right now debating and discussing legislation that would introduce a right to a break for all carers in Scotland, which is brilliant. And actually to have, and colleagues from Shared Care Scotland may well have shared some of this with you. But my concern about this is that that right is brilliant to have in statute. But if you don't have the infrastructure to support that, that right almost becomes worthless, because firstly, you might have no access to a break whatsoever, even though you've got a right to it. Secondly, you might get forced to use a service or a facility to meet that right, but it's not fit for purpose. So you're very lucky if you get a gold standard, and you might not get as much of it as you need. And if you do get something else, it might be inadequate to your needs and actually counter to the benefit that you might get, which again, as you described, is often short-lived. So I think in terms of what we need to see is have a conversation about, if we're talking about a right to a break, then actually we also need to be talking about the infrastructure that supports that. And it's crucial to get that right so that people can access a break. And I suppose to the final part of your point, I will be sharing this research with the Scottish government and others who are exploring this issue, so that make sure that they too factor that in. And it's an argument, certainly, that we make at Carers Scotland, and obviously Don Williamson from Shared Care and others, we make this discussion all the time to government, is that rights are great, but you need to have the service in place to support that.
Absolutely. We actually just had a conversation with Emma Miller and Don Williamson at the Break Exchange Networking Hour on Monday about this. So we had a really good discussion about this new legislation and how it's great in theory, but it'll be interesting to see how it gets implemented and what funding comes with that to ensure that it is the right respite for those family caregivers. So great. I see Susan Summers has her hand up. If you want to come off mute and ask your question.
Hi, Richard. That was
Hi.
edifying and affirming. And so, yeah, really wonderful. So I have a question that's a bit about methods. Cassandra Furman, and who's also on this call, and I are working with 4 programs in the US, 4 respite programs, and we're helping them do evaluation. And we're trying to move past this sort of pre-post, you know, stress to wellness, and also just the consumer satisfaction. And so I'm so impressed with the quality of the information that you got. I'm a qualitative researcher as well. So we've just been exploring ways to help programs chart a caregiver's experience as they go, so they can make good decisions to improve that experience, and just actually recognize what they're doing and its impact. So what questions did you ask to get such good information? And just your researcher's hat, what's your opinion about just kind of using just a few probing questions periodically to dialogue with caregivers as we provide care and make adjustments based on that way of evaluating programs?
Yeah, no, I mean, thank you. That's a great question. I mean, I tried to take what was this. Well, I did quite a bit of reading, and I tried to take a sort of a phenomenological approach, and very much tried to sort of capture their experience of having a break. And I actually, my topic guide, which I'm just trying to frantically pull out, which obviously contained the questions, but where I mean, I read some interesting literature that helps support some of the way I frame my questions, and I think what was really important to me was to create that space to get that kind of experience, the rich experience that I wanted in terms of the answers to questions around what does that break mean to them from their perspective. What does it mean to you? Not a prescribed, is it? And I think certainly when I was doing the literature review, what was abundantly clear to me was that the disagreement between whether breaks work or not almost falls exclusively on quantitative says not so much, not clear, indecisive. Qualitative nearly always says incredibly positive, incredibly rich and powerful that breaks have. And I think sometimes it's the way that things are measured quantitatively that makes it really difficult. So if you ask a carer what's their stress level, it might be, and whatever the scale you use and whatever tool you use, it'll be high, 8, 9, 10, whatever that is at that point. If you then ask them after a break what's their stress level, it's probably still going to be pretty high because they've been caring for 10 years and a very intense role. And actually what breaks do is just maintain and support. Now, if you were to read that quantitative line as a one-off, you might say, well, that's having no effect, but actually it doesn't tell the real story. It doesn't tell the true story of what that person is experiencing on that break, because the break isn't going to solve the situation. It can't solve the situation. The situation is, but it can help that carer immeasurably in terms of that experience as sort of I've identified here, and actually is really coherent with the rest of the research when it's qualitative. Always seems overwhelmingly positive. So I think is when we're evaluating services and respite services, we shouldn't fall in the trap of trying to measure just quantitatively, because I don't know if that will tell the true story. It's actually those in-depth conversations and actually getting to the root of what the carers experience as a result of that break and what it means to them, I think actually will help demonstrate that services are probably much more effective than just the quantitative would say. Hope that answers your question.
Yeah, that's really helpful. Thank you.
Yeah, thank you. And such an important reminder of the, I think, complementary value of both qualitative and quantitative research, because, you know, in many ways we do need the numbers. We, you know, a lot of times those numbers, you know, speak in a different way, but the stories, we always say the stories are what sells it, right? Like that's what really helps you
It's just so
contextualize.
interesting. The research just showed it's almost like two different stories when you looked at the quantitative stuff compared to the qualitative stuff. And it's quite interesting. And it shows the power actually of, like you say, exploring both methodologies when assessing and evaluating services. I do think sometimes, certainly in the UK, we're quick to hit the survey button and try and do pro formas to capture experience, but it doesn't always capture the real meaning of what's happening.
Right. We have a couple questions in the chat. The first one is, what about respite that takes place in the individual's home? Does that alleviate any of the anxiety or negative feelings that caregivers and individuals have, because it takes out the difficulties of finding the right institution? So I know that wasn't exactly what your study said, but comments on that?
Again, I remember from obviously doing the literature review, I looked at all forms of respite, and I think again, in-home respite facilities can come in multiple different ways. So there is in the UK, I'll just talk it from a UK sort of Scottish perspective because it might be slightly different in other areas, so I don't want to conflate. But so like in the UK or in Scotland, if you've got, say for example, some of the people that I spoke to, they have complex health and social care needs, and actually they will get a professional paid for service by the state coming into the house 4 times a day. And that person will come in, or often it's 2 people because of the nature of the caring role, maybe help the person get dressed, provide personal and social care, help them prepare meals. And actually, there are opportunities to provide what are micro breaks, actually. So many carers will use that opportunity. So the carers come in, they're going to be there for an hour to help them get up. So they quickly dash out the door, go to the shops, do some personal admin, have a break. One of them at least described going on a dog walk, using it as opportunity to walk his dogs. And so that's in-home respite, and that can work. And you also then get the opportunity that if you don't have that kind of support package, maybe you do, the carer does all of that caring on their own, but every so often they can either through the state or their own, they pay for a carer to say come in, and it might be more intense. It might be they come in for 8 or 10 hours a day, or they may come in and live with the person, which allows the carer to actually go on holiday. And that happens as well, although that's certainly in the UK is not a common model. But the problem with that again is that certainly the evidence that I've seen suggests that that can be effective, but equally it often it depends on a number of different things. Firstly, you need to have consistency in application of that service. So like you need the 4 visits to happen every day as planned. The 2 people need to come, they need to be qualified, they need to be trained, they need to have the person that's the carer needs to have trust in them that they can do that. And that certainly, because we talked about this, there's probably more papers in my research than I've presented here, but this was one of the things that came up quite a lot, and actually was that often carers felt that the people coming into the house they couldn't trust, or actually only 1 person turned up and not 2 because of staff shortages and other priorities, and that meant that the carer had to help the cared for person, so they didn't get that mini break. And then so lots of inconsistencies make those breaks difficult to have. And again, same with the if somebody was to come in, if it was again reading this, if somebody comes in for a period to give someone a break, then again, if it's not the trust, the confidence, or then it just all starts to fall down, and then there's a big question around availability. So I think in-home respite can work, certainly from what I've read, and certainly anecdotally, and certainly from speaking to those carers. But lots of things need to be right for that to happen.
Great. Kind of building off, you mentioned a little bit of this in that response, but a follow-up question is also, how does the funding for respite work in the UK? Is it covered by the national healthcare system? Is that a barrier to respite that families experience?
Well, yeah. So I mean, the National Health Service covers. We break things down into 2 bits actually. So it's the National Health Service covers healthcare, and then social care is what would cover things like respite. And so it's 2 distant funders. Now, every person in Scotland who has conditions that would require them to have support gets an assessment. And actually a carer can get an assessment as a carer. So they both can get an assessment. And that assessment will basically dictate the level of support that the state thinks that person should need and should get. And then that can be translated into services, or actually in some instances, and quite frequently, people take a financial amount of money from the state, and then they use that money to purchase services themselves directly. So that means, so again, and in this study, the carers I spoke to, there was a mixture. So a lot of them were getting no financial support from the state for respite, and they were using their own resources to pay to go to Lukey House. Some were getting some support, so they topped up themselves where they could, and others actually got quite generous financial support, and were able to access the Lukey House service and other services sort of fairly. So it's inconsistent, and it often depends on where you live. So in Scotland, it's broken down by sort of local authority or local government regions. So yeah, depending on where you live, you might get a more generous amount, even though your condition and your circumstances may be similar to the person living 10 miles down the road who lives in another area, and they might decide it. So that can be a huge barrier to getting access to respite, because if you get a generous amount, then brilliant, you get a lot of support. If you don't, then you're left with choices around, do I get a break? If I do get a break, where do I get it? And is it good enough? Or do I have to pay money? And if you don't have the money, then obviously you're really going to struggle.
Yeah. Yeah, that's a challenge in the US too, is we even have people who will relocate to other states because there's better social service supports through Medicaid, which is just, blows my mind. There was a question from someone who had to jump off, wondering if it's possible to get a copy of the slides. So I don't know if you're able or willing to share those.
I would, and I'll just need to double check because obviously I'm conscious about publication.
Yes, yes.
So if not immediately, I would certainly be happy to share them in at some point in the future, and then hopefully I'm kind of
Perfect.
hoping, actually, it's been with the publication for a wee while, so I'm hoping to hear back fairly soon as to whether
Great,
it's
great. And if we do get those, we will post those on the website again with the recording of this as well. And definitely encourage you, once the publication is available, we can push that out in our newsletter and share that with the Break Exchange as well. So please share that. Probably have time for one more question if anyone else has a question or comment they want to share with Richard. I have one quick question. I'm impressed that you had so many men. And so I'm wondering if you noticed any differences between responses from men and women, or was it pretty consistent in the themes that you saw?
Do you know what? It's not some, I mean, again, it's one of those things I was really lucky, I think, in the sheer volume of data that I was able to get from my 10 interviews was huge. And I could, again, there's probably 3 or 4 papers in there in terms of different issues that we managed to touch on. But I was obviously very much focused on this particular aspect. But I think what was interesting was there wasn't a massive amount of difference. I think, interestingly, I think the men very much talked, actually, to be fair, it's quite similar about duty and responsibility. And this felt, in the men's instance, it was all spouses that they were caring for. And I think that's often what you find in caring roles where men are the main carers, is the fact that they're usually caring for a spouse. So when it's people caring for elderly parents or for children with disabilities, it's often the mum or the female in that caring role. But when obviously sometimes it's a spouse, the choice becomes less because it can't be the wife because she's the person being cared for. So circumstance dictates. And actually, what was surprising, and again, this might be just a virtue of the fact that these people put themselves forward to be interviewed, was just how honest and open they were with their feelings about it, and actually how they were quite similar in the sense to what they described to the female participants. But you sort of wonder, is that because the men that might have been far are not going to have an interview? So yeah, it was. So there was no obvious differences, but it was really interesting to have the fact that the 6 of the participants were men, and to sort of get that perspective, because it is quite rare. And again, I'm assuming it's similar because generally these things are, certainly in Western democracies, is that the vast majority of carers in the UK are women. And it's so to get a good response, and actually often when we see in other research, it's nearly always we get great response from women. So we do a survey every year of carers, and I think we get 80 to 90% of the respondents are female and only 10 to 20 are male, which doesn't reflect the population in terms of caring population, where it's about 60-40. So yeah, so it was really interesting to have that that split. But again, probably without delving into it really deeply, I wouldn't know. I'd have to unpick any real differences, but headline wise, they were probably fairly similar.
Yeah, thank you for sharing that. Well, again, we're coming up at our time here. So again, want to just give a big thank you to Richard for being here today,
Really
sharing this study, and definitely share that link to the publication when it's ready. And we will post the recording of this on both the Break Exchange and Arch websites. So if you
yeah, I'll happily share those.
Share this with others, please promote it, and we will look forward to seeing you all at our next Break Exchange webinar coming soon. Thank you so much.
Thanks, everyone. Good morning, good afternoon, or good night.